Hey everybody, it's Matt and Dyan. Welcome back to OK Aussie. It is currently Thursday the 5th of June and the time it is 2:34 p.m. So she's having a thing. She's doing a thing.
My heart's not happy.
No, your heart's not all that happy, miss. We're just actually applying a third dose. Now that's actually not all that common. Normally a single dose of nitrolingal or GTN spray is more than sufficient. We've had 5-minute intervals, we've already applied 2 and we're now up to our third dose. Hey Google, set timer, 5 minutes.
Sure, 5 minutes, and we're starting now.
So it's a thing, yeah, there's a thing happening. Current temperature is for Dyan, how much? 37.4 degrees. She's just on the cusp of febrile. 37.5 is where it gets a little bit too warm. We start to take more notes. So I've also given her a Panadol Osteo 365 just to try and bring the temperature down.
Shaky.
Okay, so shaky from the spray. When you've had a vascular constriction spray, it will actually give you a headache, and it will B, give you the shakes. It's a bit like taking a steroid sort of thing. So that's all right, that's to be expected. Now, we've obviously got pulse oximetry on so that we're measuring. She's been all over the shop as usual. With obviously taking a spray, we expect things to be a little bit heightened. So the heart rate should go up, the blood pressure should go up, which it actually has done, but it's flapping around. Blood pressure when we've taken the reading was 103/65, heart rate of 57. Now that was in sitting up position in bed at about 40 degrees. So normally we expect to add about 10 to 15 milligrams to that reading, and that was pretty consistent. We're just monitoring. Now look, for most people at home, if you do get to the third dosage of nitrolingal spray, you're going straight to hospital. Do not pass go, do not collect your $200. Get on the friggin' phone, 000, get there, done. Complicated patient, we expect this, and unfortunately we have to go with it and monitor, so we don't panic at all the small things, but we do monitor heart rate and oxygen just as much as her oxygen drop saturations. At the moment we're at 92%. We're keeping an eye on her respiration rates, which have become more shallow. She's not getting as much oxygen in, which is something which is of concern, but we do obviously have a medical oxygen concentrator in case we need that during today's event down here, and we're not going to apply that until the alarms go. So we've set the alarms on the device. 90% is the threshold for oxygen saturation. That's when we start applying supplementary oxygen.
I don't like this.
No. Now, one of the key triggers, unfortunately, is Dyan started some bowel prep medication, so that's going to be triggering into this as well. It's an amplifier for this. She's also has some dystonia today already. We've seen that doing simple things. She was painting her nails. Her nails decided they didn't want to participate. Neurology. She sells seashells by the seashore.
No.
Too friggin' hard. What day is it today, Dyan?
I don't fucking care anymore.
That's pretty much answered the question, doesn't it? Okay, no problems at all. Dyan, I'm just going to give you some clonazepam as a muscle relaxant just before we lose you. And we have the ability for you to swallow. Clonazepam, 2 milligrams. I'm going to give you some CBD in a second as well, sweetie. Yeah, well, that's how we play the game. Dyan's going to have some problems with dysphagia and swallowing, and before she goes totally offline where she cannot actually swallow, let's actually get some medications into her now. Oh, honey, just take that for me, please. Good girl. Current time is 2:36 p.m. This is clonazepam 2 milligram as a muscle relaxant. Do you have any nausea, Dyan? Coming in, sweetie. Or we go totally offline. Good girl. Sorry, of all things, classically I just had a phone call from Dyan's doctor's clinic, but there was actually an administration phone call rather than the doctor, and that wouldn't actually help us in the moment anyway. Dyan, of all stupid things, has just been rescheduled for gastroenterology and colonoscopy at the hospital, which has still yet to address all the outstanding issues of concern. for a colonoscopy and endoscopy in about 5 or 6 days time. Yeah, no, you're going to have 7 days of preparation before you even commence this, but they want to just put her right back in without actually addressing any of the outstanding issues or concerns to keep her safe and protected. And while she's having, I don't know, the thing that she's having right now, a friggin' seizure. Starting tonic-clonic seizures, current time's 2:39. Just stand slightly to the side. No, sorry, because only because we've got the camera there, so I'm just obviously I can monitor what else is going on. Just take that bed down flat. On the other side, you'll see a remote control. Just actually bring it all the way down in case she rolls over, and that way we don't get her to, stop that one. The next one, that's the one. Move that pillow from the head totally out of the way.
Her pillow?
No, just that one there.
Yeah.
Thank you, darling.
Do you want the bed lower? No.
No, that's perfectly fine. Thank you. We've got one of Dyan's new support staff today on board, Brittany, so we're just giving her a lesson in seizure management, funnily enough, and guess what we're doing right now is having seizures. So you can see we've got multiple things going on dystonically. So in here is oromandibular dystonia, where the jaw is thrusting. You've got blepharism, which is affecting the eyes currently. You've got seizures in between this, which is affecting the upper quadrant, which is where these little tics and other sensations are going. Oxygen stats are now just hit 90. We're about to go below threshold. Heart rate's at 70. Tonic-clonic seizure, full convulsion set. Okay, it might be subdued because I've already just applied emergency medications. That's great. Lovely. That was 240 with that. Good girl. You're doing really well. It's going to pass, okay? This is why we've been able to jump on board very, very quickly and give her emergency medications at the first layer. Clonazepam as the muscle relaxant will help the dystonia. The CBD and all that will help with any of the pain. She's had some Panadol osteo as well, which will bring the temperature down, so she is quite likely having a febrile seizure at this point in time. She was at high likelihood. We've got some cranial tilt happening at the moment. So the reason why the neck is tilting on the side to the left is an axial tilt, which is part of cranial dystonia. You're seeing the jaw movements at the moment, which is part of the dystonia. That's the oral mandibular muscles, which is causing that little flapping and fluctuation. With the teeth are grinding, that's called bruxism. When the eyes are like this, so they're half open at the moment, but she won't have control of the eyelids or eyebrows at this moment with the muscular. Oh, sweetie, we're getting some focalized dystonia around the hand. You're doing really well, sweet pea. This will pass. Oxygen stats are flapping at the moment, currently at 91%. I'm just getting the medical oxygen concentrator ready to apply. Dyan's having some struggles with breathing through this, and the dystonia is not going to be a thing that's helping. You see the jaw clenching, which is where the bruxism occurs, where the teeth will be grinding. The muscles of the oromandibular, you're still getting left tick sensation across from the left deltoid. Mild dystonia in left focal, so the ring middle fingers are actually concaved coming in. There is no dystonia in either peripheral of the feet. Yes, sweetie, I'm going to apply this. And no, it doesn't smell all that nice, but it's just going to help you breathe, okay? And you're doing really well. You're doing really, really well. Very mild dystonia right hand side, more focused around mid-range of left still. Current time is 2:43 PM. Just going to bring the oxygen concentrator up to a level 3 output. It's just going to help a little bit of sustained oxygen through that. Getting some syncope during this as well, vasovascular syncope, hence why passing out, still getting tics. Willow's exited the building. There we go, just keep you in more of a line. Doing really well, sweet pea. Right here. You place this on the side. Quite common if she goes into full tonic seizure, she'll always, 99% of the time, roll to her left-hand side. But I don't keep her into a recovery position, mainly because of the strain that it may have upon her neck, particularly with CCO, cranial cervical instability, and those nerve impingements can cause more damage. Still getting sustained oxygen stats at 90%, hitting threshold now at 89. Just increasing the throughput of the pulse for the oxygen concentrator. Really do need medical oxygen cylinders at this point in time. Heart rate is at 52. Oxygen stats are at 90. Okay. So you can see the eyebrows are engaging. So that movement coming across here is blepharism. The blepharism are the muscles that are engaging, that are causing the different fibrillations and fluctuations. There's a bit of a droop down on the right-hand side eyebrow as it tucks down, like a facial palsy. And you can continue to see the dystonia in the mouth. These are all involuntary muscle contractions. Yeah. There's a mixed messaging communication coming out of the basal ganglia in the brain. Dyan's got bilateral calcification of the basal ganglia, and that part controls the muscle movement communications to the parts of the body. We'll just hear that. Oxygen stats have increased up to 95. Just bringing the concentrator down to a level 3 throughput. Immediately dropping down to 93. We'll continue to decrease it at level 4 to maximum throughput. Really do need oxygen in the cylinder. It gets a higher pure oxygen grade, which will bring her levels up better. That's all right. We'll pass. Tonic seizure, 246. Just supporting the neck. Once again. Rather than doing a roll, she's doing a full back arch. So that puts a huge amount of pressure onto that neck.
Okay, so that's what you're doing.
So all I'm doing is just supporting so that she's not weight bearing down through the whole region, which will then push the jaw out as well. Oxygen stats are at 97, improved. Heart rate is at 54, static. Dropping heart rate.
You're doing well, sweetie. Let's do here, okay?
That's heart rate just dropping down to below threshold of 49. Room temperature is at 25 degrees, so we're at a perfect range for temperature. Still getting oromandibular dystonia at the moment, so it's part of segmented cranial. Tonic-clonic seizure. It's all right, darling. It's all right. It's okay. Bring that out. That's what you need to do. It's all right. That's it. That's it. I'm going to keep you over here for the moment. That's what we're going to do. Don't normally see that position. That's not why I'm doing it today. All right. Now let's just open up in case there's any fluid. So, doing really well. That way we get drainage, with oxygen. Slow your respiration rates down. Respiration rates every 5 seconds at the moment. Slow it down with me. Slowly breathing down, sweetie. Oxygen stats are at 96, heart rate's at 50. Alright. Contractions mid-abdominis. Still getting oromandibular. That's alright. Doing really well. Stay where you are. That's my girl. Really well. Oxygen stats remaining good at 97. Happy with that. Heart rate, on the other hand, is being a bitch, dropping down below 49. This is the first level alarms for heart rate, which we're not concerned about. This is just an alert, watch and monitor status. Dyan's had 3 lots of GTN spray recently. She's struggling with her bowels, and obviously the use of the Vasovagal is also causing a cardiac response. Heart rate remains at 49, just popping up to 50. So we're going to have some flapping around threshold. Oxygen stats are at 95. Doing really well, Bubba. Right, coming back with me. Let's go. That's okay. You've just been having some seizures. Okay. Medications will be kicking in soon, so you're going to be doing very well. Just relax. It's alright, sweetie.
It's okay.
It's a horrible feeling, but you're doing super duper well. Oxygen stats are at 96, heart rate's at 56, 59 and increasing. It's alright. We normally get accelerations in heart rate around tonic-clonic seizures. You're doing super duper well, Bob. Mould intern on both feet, but no focalised dystonia in the lower periphery. Hands and fingers are fine. We're just getting a lot of oromandibular activity. See the jaw thrusting, left jaw thrusting. It's quite atypical at the moment for Dom. Eyes are not equally balanced, so this right eye is less open than the left eye. Good girl. Nice, sweetie. Coming right here. Do you have any chest pain? Oxygen stats are at 96. Just reducing the oxygen concentrator to a level 3 throughput. See if it remains stable. Heart rate's at 53, 52 and dropping. Very shallow respiratory rate, so we're not getting a lot of big opening. Dystonic can affect into the intercostal muscles between the ribs, the diaphragm, esophagus as well, which can affect swallowing as well as breathing. That's your fun. Oxygen stats are at 95, flapping, heart rate's at 51. It's alright, Bubba, come back to me. Current time is 2:52. It's 19 degrees outside, Thursday, 5th of June, it's 25 degrees inside. We've got midazolam ready to go if the tonics don't break. It's okay. Chest indications. Hey Google, set timer, 5 minutes. Additional dosage of GTN in response to the contractions in the chest. 5-minute countdown to see how she responds to that. Dyan was at a high likelihood threshold of having seizures with all the predictability features on board. It was not if, it was just a matter of when, as we say. What were the key contributors? Yesterday, she did a thing. She went out and had some fun. Stop having fun. She went out for a couple of hours, she enjoyed herself, and the consequences of that, sheer exhaustion. She has been pacing, she has been recovering. She paced before she went out, and she's been pacing now and resting up. But we've got new staff, sorry, nothing personal, but obviously the engagement, social engagement's a lot for her to tick over. That's been an energy depleter. She also had a shower today. That's her thing that she did today. I know, one shower, sucks, right? But she did that. A bit of flapping on heart rate. Oxygen levels are really good at 97. It's alright, sweet pea. This will open up your heart and get some more blood flowing, and hopefully your heart will slow down. Diane's been complaining of chest pain in the left lower quadrant for the last 72 hours with a bit of radiation through to the back. That has been reported to her GP and also through to the hospital through the health minister in our communications, particularly today. That phone call I had was actually the clinic calling me back just in regards to have there been any correspondence at all from the hospital, which there hasn't been. Are we surprised? No, we're not. You know the journey as we go. Oxygen levels are too low, 91, bringing the throughput up to level 4. No kink. There is a kink indicator worn up on the device, so if it ever goes low, always check that first, but her levels are fine. But her muscles may not be allowing her to actually get the breathing in. I'm going to bring your chest up, now that you're a bit cold as it. I'm going to bring you up a little bit, okay? It's okay. I'm right here, okay? Oxygen's flapped back up to 94. You've got some chest pain, Bubba? Yeah. It's okay, we're on a countdown at the moment. We've still got 3 minutes counting down. It should start to ease from that. We've still got some oromandibular dystonia going on. 92, 93. Oxygen's just flapping all over the shop at the moment. We really do need some oxygen concentrator. But you know what? That's also been conveyed to the health minister and the health department. Only taking 2.5 years just to get hold of an oxygen concentrator, which is not sufficient for a patient at this level for what she's going through. Should be hospitalised, but can I get that? No. Carrying down, so under 2 minutes and 30 seconds for the GTN spray. Oxygen levels are at 92, heart rate's at 56 and stable. Sweet mate, he's so stable well. We'll come out of this. If you have any more tonic-clonic seizures, I'll apply midazolam to relax the overall muscles. Midazolam is prepped ready to go. Oxygen sats at 94, heart rate's at 50, may get some alarms as it drops below. Dystonia is a deteriorating condition coming out of mixed communications from the basal ganglia. Commonly starts for patients with blepharism in the eyes, progressing into oromandibular, then into more things like the focalized dystonia, generalized dystonia affecting the whole body. Dyan also has the cranial dystonial tilt. She's getting the jaw thrusting at the moment, which is going on. These are all involuntary muscular contractions. Now they can cause dislocation subluxations of the transmandibular joint, the jawbone, where the jaw connects, getting incredibly painful. Can cause her to bite her tongue, cheek or lips, so we've got to check that after the seizure is concluded. She can also have problems with respiration rate, breathing and swallowing during this, on top of the dysphagia already. Cognitively, before this, we had some aphasia, so some problems with her ability to speech, and cognitively she was going a bit offline. Again, we expected that. So like I said, sleep disturbances in the past week, coming out of hospital, doing bowel prep but not actually doing the procedure, has triggered a turbulence of sleep disruptions. She's had high levels of pain, chest pain particularly for over 72 hours. Bowel prep, because she hasn't been able to use the toilet in the last 4 days, she's just had to start bowel prep. Bowel prep immediately has caused an immediate reaction to her body at very low levels. So imagine going in and doing colon lightning and all the other sort of preparation for a bowel prep. She would be seizing flat out non-stop. So this is some of the concerns that we have around this. Obviously oxygen saturation drops are not good, and at the moment I've got her on a level 4 throughput, maximum throughput on the oxygen concentrator, and she's at 95%. Heart rate stabilising at 57, and we're about to come out of the timer in 10 seconds and counting with Google. If we can get any cognizance out of her, we'll see how her heart is feeling at that stage. I'm still seeing blepharism and some mild oromandibular on the left side of the jawline. Hey Google, stop. Hey Dyan, can you hear me? Hey Dyan, touch your chest. Touch your chest if you have any chest pain. Okay, on the left hand side. How bad is your chest pain, sweetie? Can you tell me? Average, higher, getting worse, getting worse. It's okay, don't stress. Trying to communicate and get information at the best of time is difficult. Dyan, being autistic with interoception, trying to work out her own internal states while she's having a seizure is pretty impossible when we don't have the equipment around us to actually be able to measure. Should be up to an ECG at the moment to actually monitor what heart rates and things are going on. Oxygen stats are at 95, heart rate's at 56. The tonic-clonic seizures seems to have subsided, so I'm not applying midazolam at this point in time. That would also cause suppression to cardiac or respiratory, so we might actually have more problems. So I'm being very cautious and avoidant about actually applying that right this second. I'm just going to feel a bit of a squeeze on your right arm. Oxygen stats are at 93%. The equipment that we've used, we have reviewed with medical grade equipment at the hospital. It is TGA FDA approved. Oxygen stats are just 89%. Just popping over threshold back to 90 and flapping. Oxygen concentrator is at a level 4 throughput, which is maximum. We're doing really well. Good girl. Blood pressure's dropped a little bit, 106/64, heart rate 55. Oxygen at the moment is showing at 90%, we'll probably be flapping with alarms. Cue the alarms. Doing really well, sweetie. Oxygen's back up to 97, heart rate's at 59. It's quite a sudden spike up increase there. Let's see if it stays. Hey, sweetie.
Won't stop.
It's okay.
Won't stop.
It's okay. I get you. Yeah, I get you.
I breathe.
Slow it down. It's okay.
Deep breathe. Oh my God.
You don't have to. Feeling a bit of rhythmic. Oxygen sats are at 97, 98. Heart rate's increased up to 64, 65, which is a good thing. Just raising the head of the bed will actually increase blood pressure and heart rate a little bit, which is what I want. Just going to drop the oxygen concentrator down to a 3. Hey, sweetie. How you doing? It's okay. I know you're going to have a bit of pain and discomfort, but it's okay at the moment, alright?
I feel like my heart's on fire.
You feel like your heart is on fire. Yes, I'm not surprised at the moment, okay? Heart is at 66, oxygen stats are stable at 97. Doing really, really well. It's 3:02 PM, Thursday, 5th of June.
I'm sorry. I'm sorry, you've done amazing. And I'm still here. You're a trooper. Why is my heart doing this now?
You're under pressure from the bowel medications, okay, and having come out of hospital going through the whole preparation, it has been the worst thing for your heart, and it's unstabilised you. I've just dropped the medical oxygen concentrator down to a level 2 throughput. She's staying stable at 97% oxygen saturation.
For 3 days I've had this.
Yeah, you don't need to be in complete rest, okay? You can't even get out of bed at the moment, so you're going to be staying totally bed bound. And you're going to be, I know it's going to be boring, yes. Alright, so boring is fine, but you're monitoring this.
But I don't want this.
Heart rate's at 62, 61. You're doing so well.
Is it okay now?
Yeah, oxygen stats I'm really happy with at the moment. Dyan, do you have any headache at all?
Very small.
Just a small one? Okay, small one's okay, we can deal with small.
Just mild.
Yes, you will be. You will definitely be okay. I agree with that. Just going to shine a torch in your mouth. Open up nice and wide from the first end. Slight grazing on the inside of the left cheek. Teeth structures seem fine coming out of that. Just some mild soreness maybe on the left cheek from a mild bite, so nothing major. But 35% of patients may bite lips, teeth or cheek during a seizure. It doesn't happen all the time and or consistently. Coming out of tonic-clonic seizures as Dyan's done, also just check your toes. Can you move and wriggle your toes for me, darling? Okay, so Todd's paresis, or a paralysis post-seizure, post-ictal phase of the legs, happens in about 10% of seizures. We've got no movement. Okay, just try and wriggle both your toes for me, please, darling.
Very good.
It's okay. No Babinski reflex, either left or right laterally. Can you feel my fingers, darling?
Yeah, I can.
Okay. Still feel my fingers on both sides equally? Yeah, and equally.
Yeah.
Good girl. Just checking both patellas. It's quite common for subluxation and dislocations for those. Can you feel my hands up here, sweetie? Yeah. Okay, cool. Can you feel my fingers down here, sweetie? Okay. No worries. Just like an iceberg, you're going to melt and you're going to get the sensation back, okay? It's going to come back slowly. It might be in the next few minutes, might be in half an hour, might be an hour. Can you feel me rubbing your feet?
Yes.
Okay, cool. Nerve conduction and all that. So she won't be able to walk at the moment, really. She won't be able to walk to the toilets. This could last 30 minutes, could last 16 hours. Okay? So commonly you will see it equally on both sides, more so maybe on the left. Sometimes, in worst case scenarios, it can affect the arms. Just slap them. Okay, I will slap them around a little bit.
Still move these fingers.
Brilliant. Oxygen stats have been stable at 97, so I'm very happy with that. We're at a lower level 2 on the oxygen concentrator, so we seem to have come out of the tonic-clonic seizure set. Heart rate is at a higher level for you in supine at 62. I'm just going to take another blood pressure reading, sweet pea. Sorry.
Oh, I can't breathe in.
Okay, slow down. The only thing I want you to not talk, but focus on deep breaths. Do your very best job of getting air in for me, okay?
Oh. My chicken's worried.
That's okay. I think Willow's just come back from keeping an eye on them. We'll sort them out.
Willow, check the chickens.
Dyan's cognizant, able to communicate at this point in time. Still has Todd's paresis on both sides. Bilaterally equal. Oxygen stats are at 97%. Heart rate is at 65. Indications of continuing chest pain through the left breast currently. Dyan's head is tilted by about 10 degrees. It might increase the blood pressure reading slightly by anywhere between 5 to 10 milligrams. I haven't had to apply ASMs using midazolam, so just returning that away. And that's a good thing because that will cause further suppression. Blood pressure is at 97 over 61. Heart rate is high for her, 58. So her blood pressure is starting to come down.
Hi. I'm okay.
You are okay. You're going to be fine. Now the Panadol is going to help your head.
Why is this still painful?
Okay, so why? Why? What have we done today? You've done 2 half dosages of Movicol. This is why you yourself knew you were cautious about not applying any of the TAMs.
I had pain 3 days before.
Yep, you've had pain. And you've just come out of hospital. You've just come out of hospital doing a full major bowel preparation with seizures, dystonia, oxygen drops and heart rate. You've done it in an unsupported manner. You've been left to do it by yourself. And it was a post-recovery for up to 48 hours to 72 hours that was not provided by the hospital, and you have done all that.
It took me 4 days to recover.
100%. And you then had sleep disruptions. Sleep is your primary trigger coming into seizures. Okay. 65% of patients with 22q will have seizure and seizure-like conditions. About 5 to 6% of those will have epilepsy specifically. Dystonia is a movement disorder that comes with it. Cardiac is the #1 killer of patients with 22q. Even if it's non-congenital, as far as a heart defect, as in something you're born with, you can still get aortic root dilation, you can have arrhythmias, orthostatic intolerance, you can have a whole range of shit going on in there. Dyan's obviously got some regurgitation in atrium and other points as well, and arthroscopy, what's that, you want to go down or up, Bubba? Why don't we do that? Because your fingers are just floating like anything. There was a bit of a pop there. Would you like the pillow behind your head?
Yes, please.
Okay, here we go. Let's do that, shall we? Alright, let's see if that's sufficient. Current time is 3:09 PM. It is Thursday, 5th of June.
It's annoying me.
I'm not surprised.
I don't know why it's not going away with all the medicines.
Yeah, because your body doesn't actually need high intense bowel prep medications right now, and it doesn't have the capacity to deal with it all. Yeah. Right now we really need a pericardiac ultrasound just to see what's happening, or a cardiac MRI to see what's actually going on. But we need a GP and or cardiac specialist to be able to do that. And we don't have engagement with the cardiac unit at the hospital because they've disengaged on because everything's right, everything's perfectly fine.
They said put
not
me
perfectly
out to
fine.
pasture.
That's right, he did say that, didn't he? Patients like you should be put out to pasture, taken up to the top paddock and shot, basically.
I disagree.
He said that. How would you feel if your doctor said, you know what, put your patient, person you loved?
I disagree, so I didn't say to
I don't know, words matter, don't they?
I went to a different room and said, fuck you.
Yeah, you've done very well. Can you just wriggle your feet for me, sweetie? I just want to see if you're getting any movement back on your toes. And don't get stressed if you don't. It's okay, it'll take time. Okay, no movement either side bilaterally,
Not
equally.
yet.
It's perfectly fine. How's your head feeling? Are you feeling cloudy? Are you feeling sharp?
Yeah, I feel like it's in the middle of the night.
Middle of the night. Well, it's a bit overcast. It could be a bit like that, but no. It's only 3:11 p.m.
Oh,
It's okay.
my God.
Oxygen starts to flapping a little bit, 94% at the moment. That's on a level 2, 93 and dropping, just increasing the throughput up to a level 3, 92% oxygen. Just want you to slow your breathing down. I want you to think of taking big breaths in. Now it will hurt a little bit, but I want you to do that, okay? Let's get to the very bottom part of your diaphragm and open it up. Work through the pain.
I can't.
Work through the pain. I need you to work through the pain, sweetie. Heart rate's at currently 53 and increasing, 59, 60, 62, 63. The exertion out of that.
The pain is radiating to the back shoulder blade.
Okay, pain is radiating to the back left shoulder blade. Alright, you're doing super duper well. Heart rate's staying static at 63, oxygen is good at 96.
It's quite painful. Do I just keep doing it?
You keep doing it. I just need you to breathe through it at the moment. I'm sorry about the pain. You're doing super really well. Big and slow. I don't want short and shallow. I want big. I know you are. I know you're trying, sweetie. Good girl. Super duper well. Oxygen stats are at 97%. Heart rate's at 57. So yeah, the correspondence that we received today, first of all, was a voice message that was left from the hospital saying that they've rescheduled Dyan's colonoscopy and endoscopy to be done in 6 days' time. There's mixed up with the communication. It's meant to be done on the 11th of May, apparently. I think we're in June already, so buggered if I know how they get the dates wrong, but they did. They also need 7 days minimum preparation to go into it, but we also need some reassurance of communication around the steps needed to actually do all the bowel prep. So don't need to actually stop if she's doing that procedure in 6 days' time. She would need to actually have stopped taking certain medications. By that point in time, we would have needed to also start to change her diet. So there are steps that need to be actually done in a timely manner. You don't just go, oh, well, let's get it done and fit it in because it's convenient. We also need reassurances that when Dyan goes into hospital that she's going to be monitored, you know, pulse oximetry to actually look at when she goes like this, that she's not left in a room where she can't reach the call button by herself, that she can actually get medical assistance, that she might have an IV cannula line in to actually replace her electrolytes and fluid imbalance that occurs, that they've got a MET team that will come when her heart crashes out and the oxygen crashes out like it's been doing today, as we've seen on the stats. They're MET call. Each of those level thresholds that you've seen when the alarms go off are MET call, emergency teams, where they'd come in and the doctors would look at and reevaluate, do we continue with the procedure, do we continue with the medications, do we give other medications to see that she's okay, because she's in syncope at the moment, 3:13 p.m. Hey, sweetie. Confirmed syncope, nasal vascular syncope, 3:14 p.m. Oxygen stats are at 95, 94.
The jaw's starting to move again.
good girl for spotting that. Just increasing the pulse oximeter up to level 4 as her oxygen stats deplete down. Heart rate's at 53. No, we'll keep her there for the moment, sustaining of the neck. If she goes into tonic-clonic seizure, we'll roll. We'll pull it back from there. I thought we had finished the tonic-clonic seizures. You're not being terribly helpful here at the moment. We're meant to be working as a team, collaboratively.
She's giving me a good show.
Yes, she is trying to teach you this. You don't need to watch the video training modules. This is dystonia with tonic-clonic seizures. And this is a jaw thrust on the left at the moment. We've got a mandibular. We've got blepharism because the eyes are consistently in the irregular placement. You can see the eyebrows on cue going up as well. Can't get a better tone. Oxygen sats just hit 90% oxygen saturation. We're at level 4. And we're just crashing out at 89% and dropping down. Because we haven't finished with the tonic-clonic seizures and the dystonia, it looks like I will be giving some midazolam after all. Because we don't need you going into status epilepticus, and we don't need an ambulance call, hey? Very aggressive segmented cranial dystonia that you're seeing at the moment.
I'm doing well. Let's do well.
.3:17 p.m. Just applied 5 milligrams per 1 ml midazolam buccal down the left side. Hey Google, set timer 10 minutes. 10-minute alarm will go when we do midazolam. We should have full recovery coming out of tonic-clonic seizures at that point in time. But we might get some suppression of respiratory. Currently flapped back up to 97, heart rate's at 57. So, you can see the peaks, you can see the troughs, you can hear the alarms, so you know that she's at a level 4 throughput at the moment on the oxygen concentrator to try and keep her to that level. She's not breathing by herself at that sustained level. We've just given midazolam. That's an ASM, an anti-seizure medication, which will work rapidly in this situation to hopefully stop both the dystonia and also the tonic-clonic seizures that she's been having. But it might have an impact on heart and respiration. We have an EpiPen if we need to give epinephrine to stimulate the heart. At which point in time we'll be calling an ambulance if we're doing that. Gorgeous. I'm just giving you some yucky tasting medication. That's what you're going to taste in the back of your throat, midazolam. That's going to make you feel so much better in a few minutes' time. I'm sorry. Yeah, I know. You don't like that one, do you? No. They should make it in a nice flavour, right? Good girl. That's heart rate dropping down to 49, 48. Oxygen stats are at 98% at the moment. And we're pumping the O2 at maximum threshold at a level 4. Syncope, 317. Heart rate's at 47. I expected a heart rate drop now that we've given some midazolam. Still having some tics. In the next 8 minutes, once the midazolam fully kicks in, the seizures should totally subside, terminate. Heart rate's back up to 51. Oxygen static at 97. Hey, gorgeous. We're both here because it's going to pass in the next few minutes. I've given you some medications where things will settle down, alright? You just relax, and all I want you to do is focus on slowly breathing, nice and big, in, I know it's going to hurt, and then out. The pain's okay. Pain means you're alive. Heart rate drops at 49. Thank you. I'll hold that down here for you, okay?
Is it gone?
It will be soon. You know the thing I'm going to look for now? Brittany's going to check when you start yawning. And I'm going to expect to see 3 or 4 good yawns in the next 4 or 5 minutes, I reckon. Yawn indications don't mean the conclusion of seizures. Fingers are crossed, eh? And normally the muscles have relaxed, and it's released from her system at that point in time, and we have a termination. When we have those, 95% of the time it means the end of tonic-clonic seizures. Oxygen stats are at 97%, and stable heart rate is below threshold at 45, 44, 46. Dyan seems to be in a vasovascular syncope at the moment, but still getting oromandibular segmented cranial dystonia simultaneously. Heart rate's back up. So that flapping of the heart rate I expect to reduce down with that. You might still get some seizure activity. Just waiting on the countdown. We're at 6 minutes at the moment on the counter. We're hoping that it'll kick in the midazolam quicker. Mild tonic-clonic seizure, 3:20 p.m. Both eyes are equal, open, pupils fixed, got a good size. Thanks, sweetie. Relax out of that. Mild contracture, right focalized dystonia. Stronger focalized dystonia in the left hand, still getting segmented cranial dystonia at the moment. Right shoulder, pop that down, girlfriend. Oromandibular and blepharism, particularly right side droop. Oxygen stats are 96%, heart rate's at 48 and dropping. Respiration rates are very shallow, so very little diaphragmatic movement. I need some big deep breaths, honey, please. That's it. That's what I want you to engage. The diaphragm, the lower part of the lungs. Come on. I know it's causing you chest pain, but I need you to breathe deeper, please. Heart rate's at 51, 52. Oxygen stats are at 97. Slow and deep. Come on. Just move my hand every time for me. Good girl. We're at 4 minutes 15 counting down. That's it. Nice job. Oxygen stats are at 97, heart rate's at 52. Come on, girl. Doing so well.
She's going into a seizure when it looks like she kind of is like hearing and she's not.
Yeah, so when she's hearing she's not, that going out is the syncope. So that's the fainting part, so vasovascular syncope.
Okay.
We're matching that with drops in the heart rate, and we're matching equivalently with drops in blood pressure simultaneously for us taking those readings at the exact same time. Not getting enough blood flow into the brain, causing her to then have that. So you've got fainting in between dystonia, in between tonic-clonic seizures. The medications that have been given for the tonic-clonic seizures are reducing the frequency and the intensity, and then else they just die totally out. Oxygen stats at 97, heart rate's at 49. Come on, my warrior. You have been doing way too much, haven't you? Little Miss Keen ADHD. I want to have a chat. I've got a new friend. I want to talk to her. I want to talk lots today. Yes.
You're making me feel bad now.
No, not your fault at all. You were just very keen.
That's good.
Keen is good. 2 minutes and 54 on the countdown timer. I'm hoping that her body will start to relax, and we'll show that through signs and indications of yawns. Oxygen stats are at 96, flapping a little bit, 97. Heart rate's at 52, 53.
Is it gone?
I think so. We're getting close to it, sweetie. You're a little bit in and out at the moment, okay? So just relax in that position. I've got eyes on you, so just safe.
It's tight.
I know it's tight, but I'm not applying any more GT and spray. I'm sorry. No, you're trying to wake up. It's okay. The medications that I'm giving you are going to be a bit suppressive and will be making you tired. Oxygen stats are great, 97%. I'm just reducing the throughput down to 3 on the oxygen concentrator. Heart rate's at 49. Yeah, I can hear you. I'm sitting right next to you. The passing out, the vasovascular syncope, does with the eyes open. You also get it with a bit of pallor change and a bit of perspiration around that as well. Like I said, it's just not, the heart is not pumping enough blood to the brain during those sort of moments. The head pain post-seizure, which is also a good indication so you might be coming around out of the seizure sets, tonic-clonic, quite commonly will get pain temporalis, frontalis, and just in this midsection here of the cranium. So it is temporary pain. The pain will go away in a couple of minutes' time. You've also had some GTN spray that opens up here for the pain in the forehead. You're doing so well. First of the yawns, measuring 325. 1. Brittany's going to keep count, okay? Your countdown timer is less than 1 minute now. So we've actually seen a 9-minute response to midazolam, conclusion of hopefully the tonic-clonic seizures, and the indicators are the yawns for that. Oxygen stats are remaining very stable for me at 97%, on throughput 98%. I'm just going to bring you down to a level 2. You don't want to ever over-oxygenize. Having too much hypo-oxygen is also a bad thing, but I need to make sure that she's breathing by herself. Going in and out of syncope and oxygen flapping is not a good indication. High five, girlfriend. Go. That's almost cruel, isn't it? Gotcha. Yeah, thank you. I can still work out the middle finger. Yeah, good on you.
You are a trooper.
Read between the lines. Thank you very much. It's so funny, hey? You got a comedian here. Well, it's not a stand-up comedy act, is it? Hey? Jeez. Hey Google, stop. That's the end of the 10-minute timer. The midazolam was applied 10 minutes ago. How are you feeling, sweetie?
I feel a bit clearer.
A bit clearer, good. So the indications coming out for her were immediate pains in the head. That gives us indications, and they will normally feel quite bad. We don't want to give pain relief because within 2 to 3 minutes they will normally dissipate. It doesn't mean that the dystonia has concluded, and she still might be getting segmented cranial dystonia, and she still might be having cardiac. Multi-symptoms at the same time. Just because we've got one fixed doesn't mean the other things are suddenly fixed yet. Dyan, can you wriggle your toes for me, please? We have movement of the right and left feet. Yay, we've unfrozen you. Well done. You can no longer be the princess from Frozen, I'm sorry. Oxygen stats are great at 97. This is on a 2 throughput on the oxygen concentrator. Heart rate's being a bitch at 48. Well, you're flapping in the 50s.
Very sore.
It is very sore. Now remembering with the heart rate, the level is set to 2 parts. The first level is 50. That's a standard Met call. We know that Dyan's bradycardia can obviously go lower. If she's getting into the 40s,
The habits obviously don't like 50.
no, because just in hospital with a Met call, oxygen below a certain range and heart below a certain range. But you're a little bit different. You're the different Pokemon. Okay, you're the rare Pokemon.
They're scared of me because I make them.
See how she's a little bit flushed in the face with the redness. Okay, so that part coming through. Yeah, you are. So we're just going to take a temperature on you. Current room temperature is 24.5. External temperature is 19 degrees. Okay, let's see if your temperature's gone down a little bit.
I had a
37.2, so we've gone down a few notches. 37.2 both sides. I take both sides. If one is a false reading, I've done 2 sides. If it's starkly contrast, I'll do a 3rd reading. I can average out, but I want to make sure that it's accurate. A lot of people just do readings somewhere in the air and they think it's just a magic reading. It's like, Jesus, seriously, doesn't help anybody. 2 yawns, she's counting.
Yeah, oh,
good job.
I missed that one.
I sometimes do that too. That's why I encourage her to do that. I look for 3 or 4. We get to that point where the body's relaxed.
It's still hurting there.
Okay, so tonic-clonic seizures, I feel we're out of that phase. Dystonia, we may be still showing a little bit of that. You've released from your Todd's paresis or paralysis.
Like just annoying.
Okay.
Twitching.
Now, with that coming through, jaw open and close gently. Let's see if you've got dislocation, overbite or underbite. Can you just open your jaw nice and wide but gently? Don't overdo it. How does that feel? Stiff. Can you do a gentle tug side to side, left, right? Okay. Good girl. You're doing so well.
Oh, it's so stiff.
Are your teeth under or over or neutral? Okay, over from the top. A little bit over. It's okay. I'm not going to play with it for the moment.
No, it'll go back
It'll
in.
go back in. Sometimes we have to actually relocate the jaw,
Okay.
actually push and push at the same time. Because it could be a full dislocation, it could be a sub-dislocation, it can hurt both sides. Oxygen stats are static at 97. We're going to take down off oxygen concentration at the moment. Heart rate's remaining good at 63.
What?
For yawns.
Yay. Oh, good.
Yep. Hey, this is not an oxygen bar in Sweden. What are you expecting?
It could be vanilla.
Could be vanilla flavoured oxygen, right?
They do need oxygen bars.
They do. Now, nothing's going away yet. We're just getting ready just in case. I want to see you stay stable without the oxygen. Like I said, we don't want to give you too much and cause more problems. Currently at 96, 97%, 98%.
Oh, 5.
5. Excellent. So we can confirm that the tonic-clonics have finished. It will be a very, very rare situation after getting to a 5th yawn that would go back into tonic-clonic seizures. That would be a really concerning situation of going then into status epilepticus, rhyming seizures where medications are not actually stable, and would then be considering hospitalisation at that point in time. The TJMs, transmandibular joints, either side will be sore because of the dystonia, and particularly the oromandibular, that jaw thrusting. It puts a lot of pressure on the jaw muscle and obviously the ligaments and tendons supporting. Head pain is going to be common. We can ask her in a few minutes' time whether the head pain is sustained, and then we can give some additional medications to help with that, depending on where she's at. Heart is my major concern. There is to be no more bowel medications today whatsoever, so that disrupts the plans of what she was going to be doing. The safest, okay? And we can deal with that separately, but we don't want to do medications that exacerbate in one. And that's just a Movicol. She can take up to 4 Movicol in a day and multiple other medications, and she's only had 1 in 2 half dosages. So this is why we do the go slow approach with medications for her. Go slow and steady, monitor. It's catch-22. You do something, trying to fix something, it can have implications on other areas. Now catch-22 is actually one of the names of the condition 22q. Because it basically, I know, right? Classic, right?
Yeah.
So catch-22 is if you fix or do something over here, it has an impact and effect on other areas, and that's the same thing for patients like this for Dyan.
So that must be terrifying for you, obviously, going through.
You just don't know what you're working with next.
Yeah.
You know what I mean? So just like I said, you've got the seizure, you've got the dystonia, hopefully underway, you've got the paralysis underway. But what's happening with respirations? They're okay at 97% at the moment. But the heart, she's still giving me indications of that. So what is happening with the bowel?
Yeah.
So we can't manage bowel medication, and we can't see what's going on. I'd imagine if I was to hook her up at the moment with an ECG, she'd probably be having some arrhythmias, so irregular, probably on a long Q spike. I'd be suggesting at the moment. You might see some post-tick action, a bit like when you have an earthquake, you could have pre-quakes and post-quakes up to the big event. Same concept with seizures, you might still get some ticks or some Tourette's. That's okay. I've got the bed elevated a little bit just to help your oxygen and blood pressure.
Maybe if I ate something, would it help?
Yes, it would. We will. I'm just going to take a blood pressure. That's your heart rate at the moment.
It's in pain.
It is in pain.
And you know what? For 3 days it was painful.
Yep.
Off and on.
I know, right?
Today, this afternoon, it's non-stop.
Right. Well, I'm hoping that this is not going to mean that we're going to be going to hospital today.
That's what I'm hoping. I really don't.
I would really, really, really like not to too. Thanks very much for asking.
I don't understand why.
Current time's 3:33 p.m. Just relax and talk for a moment. Oxygen stats are at 97. Heart rate's at 57. We've concluded the seizures. I feel the dystonia should be wrapping up a little bit, if not good. So there's a bit of slight palsy on the right-hand side eyebrow with droop at the moment. Feet have recovered from paresis.
That would be terrifying, not being able to move your legs.
Yeah, it would be. Syncope. Oxygen is good at 95, 94 is crashing down now. Heart rate is at 45, 44. Jesus Christ, on a motorbike. Blood pressure is 97/59. It may be a simple response from the compression. Let's just see if it picks back up after blood pressure. Hey, you. Blood pressure was 97/59. Heart rate was 45. Just in case the medical team don't actually believe me. There we go. Don't worry, we'll be doing a full report afterwards, as we always do, for no one to read.
We need to look at my heart closer.
Yes, they do, sweetie. They actually have been recommended and requested to do an MRI, contrast, cardiac.
I've got things to do.
You got things to do, places to go.
It's just rather inconvenient.
Bloody inconvenient, isn't it? You know, you got a life to lead.
You just met me. It's very inconvenient.
We were trying to have a conversation. This is just not okay with me. And I blame the hospital.
That is heart rate 49. Right, we're going to try and give you one of the juicy packs just to get you something into you. Is that okay for you to try?
Yeah, you got no custard ones.
No, I know that. Now, sitting up is also going to increase your blood pressure and heart rate a little bit more too. Okay. Which is what we want.
Have a juicy pack. They're delicious. They're really nice.
Yeah.
Grab your chair, sweetie. Right, it is 3:37, Thursday, 5th of June. We've come out of multiple tonic-clonic sets. When you have multiple, it becomes status epilepticus after 5 minutes, which is what we hit. Sarah, the neurophysiologist at the hospital under the neurology team, yeah?
She looked at my 22Q.
Yeah.
She said to me,
She said,
for some people, seizures are caused by heart.
yes, absolutely.
So they need to check out.
Oh, that's a funny thing that you mentioned that.
We could resolve seizures and heart
Could do.
at the same time.
I know, that would actually mean that the teams would have to actually coordinate, cooperate, and work together. What an unusual thing. No one's under 22 different specialists. Nothing to do with 22Q. It just means that she happens to have 22 different specialists at the hospital. And a heart that doesn't want to play very nicely. Oxygen starts at 94 and flapping. 48 for the heart.
Well,
Come on, you. You can do better than this.
I'm trying.
Try harder. I know, seriously, right? On the cheer team. Yay!
I have nothing to like slap you with.
I know, right? Tell me about it.
Noodle.
Come on, Zara, get in there.
Hey,
She's got a little pointy bit, I can poke you.
I will tell on you.
Yeah, I bet you will.
Willow sent me that.
Yeah, she did. One of our lovely subscribers from our online channel.
Oh, cute.
Willow from Tasmania.
Never leaves my side,
Yeah.
Willow.
Oh,
Oxygen stats are at 95, heart rate's at 52, but flapping.
Zara means harmony, doesn't know.
Serenity?
Similar to harmony.
Okay. Maybe Willow can remind me, because I don't remember, I'm sorry.
But it was beautiful.
Can you open your eyes both wide for me, please, darling? Good effort. Okay. Can you poke your tongue out for me? Okay. Show me your big shock happy face. Happy face first. Happy face. Good girl. And your shock face? Okay. So you're seeing by doing that simple neurological test that we're getting bilaterally not as equal on the left and right. Something she can't open full range of movement. Tongue can't project herself way forward. So she does have about 30 to 50% capacity of being able to do this. So she's still under probably some dystonia. Can't see the face at the moment. Oxygen stats are good at 97. Heart rate's at 54. All from doing a thing. Hey? You met the premier, the ex-premier of WA, Mark McGowan, yesterday, AM.
Got a party, man.
You went to a party, and here you are in bed having seizures, dystonia, heart rate drops, and paralysis.
I didn't expect that.
Yay! Fun, isn't it?
A punishment, to be honest.
You didn't expect that much.
Maybe I've earned some meat.
How many times this morning did I warn you that we were likely to have a seizure by this afternoon, evening?
It's your fault.
I have no more to say.
Into the atmosphere.
Oh, I manifested it, did I for you? You can take your manifestation and shove it, okay? Seriously, shit me. That is funny as.
It is very funny.
How's your headaches going? Have they reduced? Good. Chest pain?
Not gone.
Not gone. Okay.
It is.
Do you have any pain over the rest of your body because you've been doing some dystonia and seizures? All your joints, muscles feeling okay? Just try and take inventory. I know your heart is going to be confusing you, but just forget that.
Nothing else hurts but the heart.
Okay, no problems at all.
Everything else, my legs feel numb and like dead legs and
legs?
my arms feel weak.
Yeah, the legs will, like an ice block,
my body feels like a lead
defrost,
weight,
and you will feel like a lead weight.
but my heart hurts.
Yeah, okay. Hurting, I will deal with at the moment, rather than having you not have a heart operating at all. So, taking neuro assessments. So, how is she speaking? Is she able to string words together, sentences together? Does she make sense?
Mm-hmm.
Is she understanding the things that you ask of her? Assessing the rest of the body. Being autistic with interoception, hard enough to realise that she refers to you or need to go to the toilet, let alone if she's in pain and where the pain might be. Yeah. So it's helpful to understand that, because then it might be indications of other symptoms, other things going on, other treatment that might be needed at the same time.
No.
I'm just going to there. Your neck was in a forward pronation. Okay, just don't want to do too much. What do you need? Come on, come with me.
No, I can do it myself.
Oh, okay. You're stubborn as. Good go. Can I have the bluey?
Sure. I don't need it.
Good.
Oh, my legs are annoying me.
Are both your legs able to move properly? Fully?
They're like half. I'll take it.
Half is better than none. Okay,
Yeah.
we'll definitely take that.
Just give me a Ferrari. Just speed off and drive in.
Oh, I wish. I've seen you drive. Oxygen stats are at 92%.
I think they're a bit big for me.
Hey, lovely. I like those ones though.
Yeah, I love Peter Alexander.
Very soft.
Oxygen stats are at 91. Can you take some nice big deep breaths for me, please?
I can't though.
I know you're shallowing out. I need you to take big deep breaths to get your oxygen levels up, please.
I'm trying, Bossy Boots.
I am Bossy Boots. Behave.
Revenge is going to be.
Oh, I dare you. Double dare you.
served.
Oxygen stats are at 93%, heart rate's at 59.
Of course.
Not fair.
No, I don't think so.
What's
No?
this? 2 against 1. Typical in this household.
Is this how it works?
This is how it rolls. Right, currently it's 3:43 p.m. You've been through a thing.
My legs feel so numb.
Numb, that will be. So, just like I said, the ice block melting, you haven't come fully out of the Todd's paresis. Todd's paresis happens only in about 10%. So 1 out of 10
last time I've had
full-on
it,
tonic-clonic seizures. No, not if you go back over the records, no.
Does that happen to everybody? Or?
No, so there's probably a cohort of, I think it's only about 15% of patients, or maybe even 10% of patients with epilepsy would actually experience the Todd's paresis.
Only 10%.
It doesn't also happen. You're the rare Pokemon and everything, you know.
Yeah,
that.
I know, but like.
Seriously, go figure, right? It's a bit like with epilepsy, where only 5% of those with epilepsy will have photosensitive seizures. She has to be that 5% that has photosensitive.
Me.
Yes, of course. You think? Of course. See, she's getting it now. I like that. Yeah, that's
I'm
funny.
rare,
Yeah,
and
that's
when
good.
you're rare and missing chromosomes, yeah, all these things happen. Everything that shouldn't happen, happen. So I'm like a manual car. So I need these doctors to, like a mechanic. At the moment, it's my heart. Hello, doctors, motherfuckers. Do you want to help me?
Hey.
See?
And guess what's talking right now? It's actually
I
the
need
heart flapping at the
cardiologist.
moment. So She actually does need a cardiologist on team.
System.
Her primary care physician has actually written to the cardiology team to say, what are you doing? This is a patient that actually needs constant annual reviewing. It is a requirement under the clinical guidelines for 22q internationally for patients like Dyan who have got risk indicators.
I'm not
Cardiology,
fighting.
Cardiac is the primary number one cause of death for patients with 22q, even if you don't have congenital heart conditions. Okay, so just being very clear of that, that this has been pointed out, this information has been provided, all the medical information has been supplied so that they are acutely aware of the situation. Because look, unfortunately, with over 7,000 rare conditions, and there's about 2 million Australians who are affected by rare conditions, not every doctor is ever going to come across a patient like Dyan in their clinical practice. Okay, they don't teach this at doctor school. Okay, so you do need to have some patience and tolerance to actually educate and advocate, and that's the whole point of our channel. It is here to help guide patients and caregivers and the medical professions about a lived experience. Here is a person with a late diagnosis at age 48 with 22q 11.2 deletion syndrome. It's a micro deletion on the 22nd, long arm on the 22nd chromosome. That's the chromosome that's right next to Down syndrome, who's on the 21st chromosome. We have 23 pairs of chromosomes. She can be missing anywhere between 40 to 60 genes. That's 3 million DNA building blocks gone. Now that affects patients anywhere up to 185 possible clinical symptoms. So it's a very holistic. You affect the cells, you affect the genes, it's every part of your body can be affected. And Dyan has got a lot of those things going on. Was this predictable today? Yeah, okay. We had that conversation with Dyan first thing in the morning. She did a thing yesterday. Sleep has been disturbed coming out of the hospital situation with the preparations that didn't go into an actual procedure for gastroenterology. So a colonoscopy and a endoscopy that she was meant to have been scheduled for didn't go through. She's been asked to reschedule that in less than a week's time, and she's like this. She's had chest pains, no surprise. Electrolyte imbalance, strain on the body, and she's having chest pain for the last 3 days, radiating around to the back. Now, most people go, get me to a doctor, get me to the hospital. We've communicated to the doctor, we've communicated to the hospital. Don't think I haven't been doing these things. I have been. I've been providing the clinical data, information, reporting on the symptoms. I can't make the health system change. I can't just say, hey, do this. And I can't also just drag a patient down to an ED because I don't treat her right. Okay, taking an autistic into an ED environment is not the best thing. It's not conducive for that patient. And if they're not also ready, they don't have the specialists who can actually interact, communicate, work together, what do? You know, this is our problem. This is the conundrum that goes with 22q. It is literally a catch-22. You fix and do something over this side and it affects 2 or 3 things over this side. That's an anomaly of how this condition actually works. We would love the dystonia and the seizures to be managed and stabilized. We'd love the respiratory to be able to look at her and realize that you're getting oxygen drops. She's on level 4 of the oxygen concentrator and she's still getting oxygen drops below 90%. She's had that into the 70s. Her body is not able to get effectively enough oxygen in. And of course, if you're not getting enough oxygen, that ain't helping your brain. That's not helping your organs. That's not helping your function. No kidding. Fevers were high. Okay, so she's always at a constant high level and we're giving medications to keep the fevers down. Febrile, 24.5% of patients with 22q will go into febrile type seizures. 65% of patients with 22q have seizures and seizure-like conditions. Hypocalcemia can affect those. Her hypocalcemia has added to calcium buildups in different parts of the body, and in her, the calcium buildups have been bilaterally placed between the basal ganglia, calcification, and that affects the communication and messaging along with a movement disorder. That's what causes dystonia in Dyan. Okay, so she has all these neurological conditions, all right, things that are going on. Real conditions. Things that are actually happening that they do need to manage and treat. And there are clinical guidelines that are provided, and we can't get the hospital to actually follow those guidelines and follow those best practices. So we continue to educate and advocate. I'm waiting at the moment to hear from the Honourable Meredith Hammett, the current or the new WA Health Minister. I've requested a face-to-face meeting with her, who's meant to be engaging with the health department, who's meant to be engaging with her hospital. Crickets. No communications. I continue to follow up. This is what an advocate and a patient carer does. You continue to communicate and advocate on behalf of your patient. Please give Dyan a big thumbs up of encouragement. She's cognitively now able to engage with her new support work. I'm sorry, Brittany, for your induction by fire. You don't need to watch that training module now. You've seen it firsthand. Well done. Tick, you can do. She has now learnt about dystonia in the wild and tonic-clonic seizures and respiratory and cardiac events in the wild. That's pretty good for your first day on the job, isn't it? Sorry, Brittany. We laugh, but you know what? It's a bit of a dark humour.
I do want to say too that that's I'm very appreciative too of it, because us complex patients, people don't tend to want to
attract carers.
Because it is a lot.
It can be very stressful for people, but if you stay calm, you work through the flow chart. We have procedures in place. And on that note, remember that we are not medical professionals to tell you what you need or to diagnose you or your treatment or management plans. So please remember that. Please go and see your own clinical team, your own primary care physician or a specialist if you need management, diagnosis or treatment. We're showing a lived experience of Dyan, a patient with 22q and multiple other conditions, as well as a patient carer, myself, who is her husband. Dyan is 51 years of age. I am 55 years of age. Dyan is under the NDS, the National Disability Insurance Scheme. We live in Perth, Western Australia. That's who we are. Big thumbs up of encouragement. If you've got questions, comments, ideas or suggestions, leave them below. It can be very stressful. My apologies for that. Trigger warning for that up front so that you're aware of what is going on. Please keep the comments sensitive to the occasion and on topic as well. And let's help to educate and advocate for all of those 7,000 rare conditions that exist. Because at the moment, there's only 5% of conditions that get curable treatment. 5% out of those 7,000 conditions get curable treatments. So we need to improve that. 50% of those patients won't even get a diagnosis in their lifetime, and they will continue to go. It takes somewhere up to 8 to 10 years for a lot of these patients to even get a diagnosis if they're lucky. Dyan was 48. She's presented to hospital thousands of times in her life and still hadn't got a diagnosis until 48 years of age. And even when you get a diagnosis, if you're not in a country that's got a specialist, what do? We have no adult specialists in Australia for 22q 11.2 deletion syndrome. There are 2 for children, Perth Children's Hospital and 1 in Queensland Children's Hospital, but they're not available for adults to go backwards and access under the Medicare system. Make it make sense. Make it make sense. The guidelines for dealing with rare conditions in Australia means that the doctors are meant to reach out to centres of excellence to engage and to communicate and to share what's going on and to get help and guidance. And we've got all the printouts, all the information from all the medical journals that I've collected over the years. They're available as a library, as a reference, as a resource to help them. Because most commonly when we go in, the clinicians, the doctors will say, what's that? What's the condition? What do I need to know? How do I help? What can I do for you? That's about it. Thanks very much for watching, guys. Don't forget to subscribe, hit that notification bell, and we'll see you in another episode real soon. Bye for now.